Hey, welcome back to another episode of the Dental Hygiene Basics podcast. My name is Dana. I am your host. You already know I'm excited to be here. I just did a episode on time management techniques, and I wanted to come back and record another episode specifically on time management techniques in clinic. This is something that a ton of students struggle with. And so I just wanted to share my tips and tricks, things that I did in dental hygiene school, things that I recommended to my students when I was in formal education. And let's just see where this episode goes. So one of the first things, and y'all already know, that I'm going to recommend that you prepare ahead of time. Preparation powers performance. I will say that probably a million times if you listen to all my podcasts. Now, if you think about preparation, the beauty of dental hygiene school is that you are scheduling often your own patients. You're often finding your own patients. So if you have a good scheduling system to manage maybe how your patients can schedule, you can get their phone number, their information, all of that kind of stuff, this can save you a lot of time. So one resource that you could use is calendly.com. So calendly.com. I'll put it in the show notes. So calendly.com, you can actually create booking schedules. So you could create an appointment that says, Dana's dental hygiene appointments. And you input the days that you're available, that are available for booking. And you can put everything in there that you need to, how long the appointments last, what the patients can expect, and then anything that you need from them. Now, just be aware that this is not HIPAA compliant. So do not ask them for any health information or any private information, but you can definitely get their name, their phone number, anything that you need to book the patient at your appointment. You could do that. Just no private information, medical history. I don't know if you could ask for date of birth or not. That might be considered private. So just be mindful of that. But again, it's a good place. People can hop on, look at your schedule. I believe with the paid version, you can merge it to your calendar. So as soon as someone books, it goes straight to your Google Calendar or your iCalendar. And that can save so much time. You could put that link or a QR code on a business card or a flyer, and people could hop on and book appointments with you. And that saves you a step. And then all you have to do is follow up, definitely confirm your patients a week before, 3 days before, 1 day before, the day of. I know y'all are going to think I'm crazy, but patients not showing up for dental hygiene appointments is very, very common. They will ghost you straight up. I'm sorry to say it. So then, of course, you need another backup plan. Does your school let you go hunt for patients? Always make sure you have 2 or 3 backup patients, maybe a retired person who is flexible and can come in, at various times. So those are just a couple of tricks that I recommend. Now, a couple of days before your patient comes in, if your school allows it, call them and start asking them questions about their health history. Do this in a private place, not in a public place. You can ask them their medications so that you can look up their medications before they come in. A lot of schools require you to write down their medications, write down their dosages, and look up any adverse effects that could come up in the dental appointment related to that medication. So do all of that beforehand, all right? So set some time in your schedule a couple of days before your appointments to contact your patient and get that information, look up the drugs. And then when you get to clinic, you already have one thing done and you already know a lot about the patient. It's going to make the first part of your appointment go so much faster. Okay. Now, once you get into things like the extraoral exam, the intraoral exam, I see students taking so long to do these. A thorough intraoral and extraoral exam, yes, you need to look, feel, listen, do everything to really assess these patients, but it should not take you 2 hours to just do an extraoral and intraoral exam, okay? So give yourself a time limit. This is one way I mentioned in the last episode about time management. Give yourself a limit that you're going to strive towards, because if you just think you have 4 hours in this appointment and you don't have a plan, like going into clinic and a way to tackle these clinic sessions, you will just waste time, taking your sweet time doing whatever. So I want you to have a plan going in. You're like, okay, for health history, I want to get done with the health history in 25 minutes. And then I want to sign up for an instructor check. And then I'm going to move on to intraoral and extraoral, or I'm going to move on to x-rays, whatever it is. And this is how long I plan to take on it. Now, you will get faster over time. So make sure you set reasonable goals for yourself. Okay. If If you need an hour for an FMX to get started, it is what it is. But then next time, let's try and shorten that to maybe 50 minutes. The time after that, maybe 40 minutes. So we just want to keep trying to just cut down, shave a little bit of time. Now, this is the time to learn, right? So I don't want you to rush the process just because you think, oh, I need to get faster. I need to get faster. You need to learn, right? But you can continue to set goals for yourself to get a little bit faster. Even if on the perio charting, like last time it took me an hour, this time I want it to take me 55 minutes. Any little bit of improvement is progress, right? And it should just get a little bit faster each time. But what gets measured gets better. So if you don't have a plan and you don't have a goal that you're trying to reach in each appointment, you just will keep wondering why you're not getting ahead and your other classmates are. It's because they are going into this appointment with a strategy and a goal for what they hope to attain, how long it's going to take, and doing their best to stick to that. Now in clinic, there's always a bunch of unknowns. How long will it take to wait for an instructor? How long will it take me to actually do this? Or, oh gosh, this patient is really chatty and I'm having a hard time manage that and controlling that. So there are going to be unforeseen things that come up. It's okay. We can always reprioritize and do our best to, still get done as much as we can in the appointment. And that's where I say is just have a plan, but don't forget to be flexible because that is a big part of being a dental hygienist is flexibility.
Hi, students. I want to take a quick pause to say thank you to our amazing sponsor, Student RDH. Student RDH is a board prep company that helps you succeed and pass the national board exam, whether you are in the US or Canada. Student RDH has everything that you need to be successful on the board exam. There are over 5,000 practice questions, 2 mock exams, and a pre-assessment, a post-assessment. There's online videos. There's an incredible textbook. And there are even live sessions. So we have live case study sessions. And those help to get you ready for the case study section of the board exam, which if you're taking the MBDA, that's 43% of the exam right there. So being successful on the cases is important and Student RDH can help with that. I love Student RDH. I've actually worked for them as a faculty member for over 2 years, and the dedication behind the scenes for the students is what keeps me working with them and is what makes me happy to have them as a sponsor. Student RDH is also a huge supporter of the Dental Hygiene Basics Scholarship. So we want to give a huge thank you to Student RDH. Make sure you go follow them on socials at Student RDH and go check out their website when you're starting to shop for your board exams, studentrdh.com. All right, let's get into the episode.
All right. So as you're moving through your appointments, you've got a plan and you're maybe setting a timer on your computer for how long you hope to take on something so that you're not wasting time. Okay. And then when you have your instructor checks, when the instructor comes in, have everything ready for them. Make sure that your tray looks nice and clean. It's well organized so that the instructor can just reach up and grab what they need. Because I will not tell you how many times I've come in and I can't get to the computer because there's stuff all in the way, or the desk is a mess and I can't find their paperwork, or I sit down and there's gauze all over the tray and there's floss and I'm having to move it all just to find the mirror and the explorer. So whatever the instructor is going to need when they come in, have it cleared and ready to go. So having a clean, well-functioning workspace, I think is the best way to save time in clinic, because I have seen so many students, it's like, oh, I got to dig through my bag and find my blood pressure cuff, or I have all this stuff on here. Where is that one paper I was looking for? So when you get to clinic early and think through your process of care. You always know you're going to start with health history, right? You're going to have to review it at every appointment. Pull the health history up, get out your blood pressure cuff, get out your thermometer, whatever it is that you need to take their vitals, have it out ready to go. Then once you're done with it, put it away. Okay. Get it out of your space and only have out what you need at that time. And then when the instructor comes in, you have everything they need right in front of you. So this also saves you time, because if you have the paper right out that your instructors need to sign, or the chart notes, whatever it is that the instructor needs to sign before they leave your room, if you have it out right in front of you and it's the only thing on the desk, it's also going to trigger you and probably your instructors like, oh, hey, I need to sign this, or I need to finish up this part of your note, right? And it will trigger you just in case they forget to say, oh, also, will you sign off on this check that you just did? So it's going to save you time, because then at the end, you don't have to go hunt down your instructors when you're ready to wrap up and go home and eat dinner and be with your family or study, whatever it is that you have to get done, right? You're not going to be so scatterbrained. It's going to help really, really keep you on track. The last thing I'm going to recommend, if there is something that makes your life easier in clinic, make sure that you're doing that, or maybe you have to purchase something to do that, whatever it is. So kind of do a clinic day audit. When you're doing clinic, think through, where am I spending the most time and how can I make that easier on myself, or how can I get faster? Because sometimes it could be so simple. You're like, okay, every time I perio chart, I have to do a tooth and then I have to roll all the way over to my computer. The computer is too far away. So can you move the computer closer? Can you maybe buy one of those little keyboards? It's like really small and it hooks into your computer. And so you can type, and even though your computer's far away, you can have your little keyboard right next to you. They have those little ones that just have the number pads, and it connects via like a USB to your computer. And then you can use that to type in your numbers without having to roll back and forth. Maybe you're like, if I could do 3 teeth at a time, that would save me from rolling as much. Even small things like, how far away is your tray from you? Is your tray at an optimal height? Remember, your tray that holds your instruments, it should be down and it should be at about like waist level. And that means that you can easily grab the instruments, and it should be as close to you as possible without like you bumping into it, so that you don't have to roll or reach up or reach down. Everything should be within arm's reach. And that seems so simple, but that saves you so much time in your appointment, not wasting valuable seconds, because seconds lead to minutes, right? And minutes lost is just precious. It's precious time when we are in clinic with our patients. Something else might be, okay, you know you're going to have to type a gingival description, or you know you're going to have to type notes for every patient. Do you have a template, something that gives you everything you need that you can go refer to really quickly, so that you know what you need to type in your notes, or that you could copy and paste and put in your notes, and then you can edit it per patient, right? Templates are game changing for saving you time when you're documenting. So I definitely recommend, if your school doesn't have something like this, ask them, hey, is there a way we could come up with a template that we could all use, or maybe come up with your own? And you could ask them, does this work? They'll usually give you a guideline for what your notes should be like and what needs to be included in them. So put a template in a Word document that you can copy and paste into your note, and then you just fill it out or you make changes. So something like this might be, you have to type a gingival description. So you might put gingival description, put terms like erythema, edematous, whatever, just to help clue you in on what words need to be in there. And then you could even copy and paste it just to make it go faster. So these little hacks will definitely save you time on the clinic floor. And I think it definitely all starts with doing an audit to see what is going to make the biggest impact. Where are you wasting time? How are you going to get better and faster? By pinpointing what is not working for you. Okay. All right. I hope you found this episode helpful. I love sharing hacks like this. I think I will do more episodes like this, because this is just making me super excited. Best of luck to you, speeding things up and getting better and faster and stronger in clinic. I know that you're getting better every single day. Don't forget to think back on where you started in this process, because every day you are progressing and getting better and stronger, and celebrate those small wins. By the end of this program, you won't even be able to recognize yourself, right? Thinking about where you started, not even being able to like hold an instrument, or how to use the computer software system, or even maybe how to like turn the chair on in the operatory, right? And so all of these things are wins. You're doing fantastic. I'm so proud of you. Best of luck on this journey, future registered hygienist. I'm rooting for you.